Here are the early signs of depression that most people miss. According to the World Health Organization, at least 5% of our population has some form of depression. It's not only hitting our adults, but our teens and our children. And in the doctor's office, 50% of it is underdiagnosed, and 50% of those people are undertreated. Sadly, we are missing the mark on depression. One of the main reasons why depression is missed is because it can be subtle and gradual and often overlooked. Hi, I'm Dr. Melissa, an integrative psychiatry physician who focuses on all things mental health, but also empowerment. Research shows that depression can occur early through life's transitions, moving, grief, loss, and this can be hard when someone's undergoing burnout, increasing life responsibilities, and they're just too busy to recognize it in themselves. When you go to the doctor's office, most of the time you see a questionnaire, maybe once a year, and it'll show you the later signs of depression, such as hopelessness, guilt, wanting to harm yourself, maybe not wanting to eat or socialize. And that may not be very clear to you. There's actually earlier signs of that. So let's talk deeper about these signs and symptoms. Sign number one, life might feel muted. You may not just feel enjoyment or feel connected to what you do. If it's your work, if it's your relationship, your spouse, your children, your friends, you may not even have that joy anymore. Oftentimes, you may not want to go out, socialize, and may just want to stay home, and you're getting into the danger zone of depression. It may even feel that you're looking at your life from the outside, rather than being present and living in it with joy and emotional connection. From a clinical perspective, this is when the dopamine, serotonin, and norepinephrine may be off because you may not have the reward or the pleasure and what we call amotivation, the lack of motivation to do things you used to love or the things you just need to do on a daily basis. Sign number two is withdrawing socially without you realizing it. You may be in a point where you are not going to your friends' birthday parties and you just rather stay home. It's not because of conflict or dislike, it's just you're uninterested, you may be not having the energy to respond to your messages, and you're just in a neutral blah mode. Most people don't consciously know that they're withdrawing, they just think that doing something that they used to enjoy is extra. They may not know that that's supportive and that's their social need and important for humanity. However, they may see it as a chore, something that is a burden to themselves. This shift may be someone who looks busy, introverted, or extremely tired. But you may not know that they may have some early depression in the background. And that's why it often gets unnoticed. It's subtle, it's unconscious, and they may not even be knowing they're in this funk. Some of the most common early signs of depression may not be as alarming as one thinks. It can be subtle and impact how you function on a daily basis. You may not be able to be present when you're having your meals. You're just eating and just going with emotions. You almost might feel robotic, but there is no emotional social connection. You may feel totally blah or even extra anxious and irritable and angry. It's human and normal. A lot of people feel depressed and have been depressed in their lifetime. Maybe it runs in your family members or you've seen it in a friend or a loved one. Number three, difficulty initiating tasks can be an early sign of depression. Sometimes you may not have the willpower or the energy or the oomph that you used to. So you can start a task, but often procrastinate. Often people think this is a lack of discipline or being lazy, but it's much deeper than that. There may be a disconnect of the dopamine reward pathway. There can be a blunting of emotions and energy and focus because of norepinephrine imbalance and serotonin. And so it's not just because one is not interested, but also because their depression is ramping up. And that can be an early sign of depression. Oftentimes when people aren't finishing their work or getting into a place where they feel paralyzed because of their depression or their emotions or thoughts, it can often lead to guilt, self-blame, or maybe the other way around, where they're constantly thinking so negative that it's just tearing them up inside. Number 4, increased guilt or self-blame. In early depression, the inner dialogue can be a beast. It really can be an inner critic because it blames oneself and blows things out of proportion. They may think, I should be doing better, or I let people down, or they may feel that they just keep missing the mark and they feel horrible. They feel crushed, and it may not be their inner truth or what people are seeing and viewing, but they just feel like it and they end up living and believing it. So having increased guilt or self-blame is a clinical indication of depression, especially if it's often, frequent, and paralyzing, affecting one's function to do things at home, work, or in the social setting. Number 5, there's often a change in time, how time is perceived, felt. People with early depression or deep depression may feel like their days are so long. They're sleeping in, oversleeping, having interrupted sleep, but they feel heavy in their body and a disconnect with time. They often may be missing phone calls, deadlines, not showing up to work or social settings. They may look bored or uninterested, but it's actually not that. It's early depression where they feel extra heavy in their brain and in their body. This is how depression affects perception, attention, and cognitive processing. Number 6, reduce emotional recovery. So when someone has early symptoms of depression, they may feel not only burned out, but it really takes a toll on them. When before they would recover in a few minutes, hours, days, it may take them weeks, months, and years. They're not able to go back to school, back to work in the severe cases, or they're just not able to go back to their favorite hobbies or see their friends and family members. It can be disheartening on the outside, but on the inside also, they're crushing and depressed. Another thing that you can look out for early signs of depression are subtle changes that may seem large and disrupting to someone. So when someone is asked to do something, or when you're having to move into a new room, it may feel like you're moving into a new country when someone is depressed, but it's really just the next room over, or they're just having to rearrange the room, but the cognitive processing can feel overwhelmed when one is depressed. Having prolonged emotional recovery can be one of the important signs to getting medical psychology support. So when you have early signs of depression, it can be subtle, gradual. It can seem as time is slowing down. Your inner critic becomes very loud. You may feel less interested in your favorite things. You may look bored, but in the inside, you're really depressed. You may have a longer time of recovering from pain, sadness, hurt. You may feel a little bit bitter, agitated, angry for a prolonged amount of time, and that can be an early sign of depression. In addition, I just want to let you know these symptoms or depression are not character flaws or personal failures. It's actually a medical pathophysiological process that needs readjustment, balance, support through lifestyle, integrated matters, or even medications and supplements. So don't blame yourself, get in the driver's seat and get some help. I would really like to hear more from you and hear your thoughts on what you think your own or others' depression signs are. It can be totally different from what I've said. It can be something that you've noticed in someone else's life. Whatever it is, drop a comment. Let me know your thoughts on these early signs of depression, or if you have any questions on lifestyle integrative things on depression. I love the comments. I love your feedback so I can make more videos. Please share and subscribe and like and really get plugged in for your health to prevent any mental health decline, but also treat it and overcome it. Thank you for being here. You're not alone. See all my resources below, my future videos and my past videos to learn more so you can get your life back.